Welcome to today's webinar. My name is Mark Brohan. I'm the editor of Internet Health Management, and I'll be introducing the webinar topic, doing the first presentation, and moderating the Q&A. Thank you for joining us. The subject of today's webinar is breaking down barriers to patient satisfaction. This webinar looks at how healthcare systems can use analytics, customer intelligence, mobile apps, and telehealth to break down walls between healthcare data and how to better use data and digital technology to help healthcare organizations increase patient satisfaction and customer service. And in addition, look at the ROI for achieving this and doing it in a timely manner. Now we're going to hear from two speakers aside from myself. After me will be Joe Brennan, who is the Senior Director of MedNow, the telehealth division of Spectrum Health, a 12-hospital nonprofit health system based in Michigan. Joe will discuss how Spectrum Health better engages patients with tools such as a robust dashboard for outcomes analytics, a highly utilized mobile app, and a digitally driven patient strategy tied to their forward thinking on subjects such as telehealth. After Joe, we'll hear from Matt Edmonds, Executive Director, Healthcare Solutions from Neustar. We'll take questions after their presentations. You can ask questions anytime using the question box on the right side of your screen. You can also use that box to alert us to any technical problems you may be having, and someone will respond to you privately. With that, let's get going. In retail, department store icon Marshall Field coined the phrase, "Give the lady what she wants." From Macy's, from the 1947 Christmas classic Miracle on 34th Street, "If you haven't got exactly what the customer wants, we'll send them down the street where he can get it." We'll be known as the helpful store, the friendly store, the store with a heart, the store that places public service ahead of profits, and consequently will make more profits than ever before. These two examples are from retail, an industry that gets customer satisfaction. In healthcare, not so much. As the above bullet points indicate, more patients are going online to manage more of their healthcare affairs, but the U.S. healthcare system in this regard is sorely lacking. In an era of consumer-driven healthcare, payers and providers win if they stop seeing consumers as just patients and plan members and more as satisfied customer. Here's how. Patients now more than ever want the same digital tools and user experience they use to shop online for managing their health and wellness and their healthcare business affairs. Consumers are paying more out of pocket than ever before for healthcare. As the U.S. healthcare population ages, consumers are also using more healthcare for all kinds of services and treatment. This increased demand for services means savvy consumers as customers are doing a lot more comparison shopping for docs and hospitals these days, as evident by the fact that nearly 80% of all searches for a new physician now begins online. Consumer demand for digital healthcare is growing, but not just for routine tasks like booking appointments. Consumers as patients also want to use digital healthcare, artificial intelligence, and robots in the operating room for more advanced care and for help in diagnosing an illness. So even though emerging technologies such as AI, artificial intelligence, robots, virtual assistants, and various forms of machine learning, which by the way are actually referred to as data analytics, are now just being implemented in various forms across the U.S. healthcare systems, already patients see advanced use of technology as being very beneficial in delivering care and how they receive care from their hospitals and from their physicians. Along with better digital technology, customers want better customer service and satisfaction. Now let's be frank. If your health system is not meeting their needs, your patients, they're going to go elsewhere. Hospitals and health systems have done a decent enough job of putting the institution online. If you look at what any hospital has in their portal, it replicates the same type of apparatus, programs, workflow you're going to see inside the institution, but now it's on the web. So self-service tools within digital patient portals are things that patients can use to access medical records and perform other transactions, such as view lab results, see doc notes, view your image scans, if you will, reorder a prescription. Those are among the suite of the 4 or 5 that most portals will offer, if you will. But the fact of the matter is, many tools are clunky, they're hard to use, or if they access lab results and doctor notes, then chances are that terminology is written in medical jargon that few consumers can understand. Just last week, there was a pretty groundbreaking survey that University of Massachusetts Med Center put out that shows that the average American reads at or below an eighth grade level, and over 90 million Americans have what they term limited health literacy. In other words, that means they have trouble deciphering what's in their medical records, even though the access to it is more relevant and easy today than ever before. So when they go online or make contact with a healthcare organization call center, consumers now expect to find self-service web tools and informed service agents that help them make better, faster, and more informed decisions. For doctors, hospitals, and health systems, consumers want websites and contact centers that help them find the right doctor or change doctors quickly and conveniently. They want help making appointments. They want to do telehealth. They want to see a doctor online, or they want help in accessing their medical records as they look for a new provider. So there's a combination we're talking about here. More important, consumers as patients also want tools and expert help in finding out the cost of a particular visit or treatment and what's covered by their health benefits. In the industry, that's called price transparency, and that is a big nut that a lot of health systems are trying to crack. So the fact of the matter is, though, healthcare providers do have their work cut out. Today, healthcare organizations that want to change with the times need to better understand what's driving healthcare consumer behavior, and in many ways, fundamentally change how they conduct business. I referred to before on the web, what we see today is more of the institution online versus what is how consumers perceive how they want to use a health system's delivery capability and services and tools. So in effect, healthcare providers can no longer just see consumers as patients, and health insurers can't view consumers strictly as plan members or employees. In effect, forward-thinking healthcare organizations must now see consumers as customers, especially as customers who aren't afraid to take their business elsewhere if an insurance or provider fails to perform. Hospitals and health systems, they use their data primarily to see and serve consumers, primarily as patients, before, during, and delivery care. That's the status quo. Likewise, health insurers use their data today to serve their customers as enrollees or plan members, especially during benefits enrollment season when either employees are signing up for coverage for the first time, or they're updating and choosing and renewing their existing benefits. But as we've discussed, healthcare is changing. In a new era of consumer-driven healthcare, organizations need better consumer data to look at it in new ways that better serve patients and plan members as satisfied customers. And this all ties back to what many see as ground zero for this, which is the contact center. In a highly competitive and rapidly consolidating industry, improved patient satisfaction and an excellent patient experience can help hospitals improve profits, help patients better manage chronic disease through better prevention and wellness, and by running a more efficient contact center, hospitals and health systems can solve patient problems and challenges as efficiently and effectively, and more importantly, as quickly as they come up. Where behavior change happens across the enterprise, yes, but the battle is won or lost on what is the front line, and that front line is the contact center. The key to transferring contact centers into proactive customer engagement platforms is data, and the healthcare industry is awash in data. A case in point, as much as 30% of the world's stored computer data is generated by the healthcare industry. But how data is used in healthcare is much different than other verticals such as retailing or financial services. In healthcare, data must be compliant with HIPAA, and is much different is how it's organized and treated and locked away than in other industries. So healthcare organizations have lots of outdated legacy systems, and they've got reams of data locked away in informational silos not easily shared. Thus, the opportunity for healthcare organizations to unlock patient data and use that universal information is to transform a contact center by using a number of forward-thinking technologies. For instance, customer intelligence, identity management, and analytics are those that some forward-thinking health systems are now using to revamp the call center. But it all ties back to universal data. That data has to be easily accessed and shared, so it breaks down walls between legacy systems and creates more universal business, marketing, and customer service data that the frontline troops can use in the contact center that benefits the hospitals by doing two things: increasing brand awareness, increasing customer satisfaction, and the result in higher member engagement for insurers and hospitals is better outcomes in helping patients, more importantly, solve their problems sooner before they become even bigger problems. Now, a case in point of who's doing something all about this, Nyu Langone Health. A great example, as I just mentioned, of a health system that's fundamentally changed how it achieves patient satisfaction is Nyu Langone Health. Nyu Langone is a big cosmopolitan medical center with a base of 1.7 million patients, and they recently and entirely revamped their contact center to achieve what we're talking about here, which is higher patient satisfaction. The Langone Call Center is a bustling, sprawling operation that employs 300 agents to handle more than 2.2 million calls, emails, and texts annually. The key to operating a better call center that would be more proactive in anticipating patient needs and answering their questions and resolving their problems was giving content and contact agents universal access to single, comprehensive patient profile data, even as the patient was calling, texting, or emailing the call center. When that call or email or text came in, by revamping what they were doing with technology, agents at Langone now have a dashboard of better tools to access and update the data from customers as they came in. So what do they do? Basically, what Langone did is they replaced outdated technology and isolated databases with new customer relationship management and identity analysis software linked to, for the very first time, comprehensive patient information. What I mean is they connected the incoming patient data with their medical records to give a more holistic view of who was calling and perhaps why to actually troubleshoot things. So it used to be that when a patient would call, the Langone call center, it would take between 4 and 5 minutes for an agent to handle a typical patient call, in part because they only had limited information on the patient. When the patient called, the agent then had to kind of decipher what you were calling about versus being more proactive in figuring out, okay, I know why you're calling, here's how I can help you sooner. That was the gist of what Langone wanted to improve. So over 11 months, Langone addressed the issue by replacing outdated technology and those isolated databases with new CRM and identity analysis software that, as I mentioned, for the first time links to comprehensive patient information via the medical record. With better technology, Langone is now seeing some results. Nyu Langone is reducing the average time it takes an agent to answer and complete a call in about 3 minutes and 30 seconds. And what they're doing by taking a whole minute off each individual call is over the course of an annualized basis, they believe they're saving up to 1 million minutes annually. The new platform with the new technology now provides agents with a holistic and customized view of a patient's needs by providing access to customer data and each patient's electronic health record. At Langone, a holistic view of all patients' medical and demographic information enables the health system's clinical staff to better gauge patients and their risk, make it easier for providers to segment what population might be suffering from what malady, and to target those population centers for patients for better outreach. So, for example, Langone can now identify patients 65 or older with diabetes, or patients who have suffered, from discharge after being in for a knee surgery in the last 30 days, and if they've missed their appointments or they've yet to schedule them, now you've got the data at your fingertips for the provider, the contact agent, or both to reach out to that patient and follow up with appointment reminders, surveys, or other education materials for healthcare when they're not being seen within the hospital or the physician's office. So, healthcare organizations that meet expectations in a new way, in a new era of consumer-driven healthcare, by embracing the concept of authoritative identity and using more universal data integrated across the enterprise, coupled with identity management technology, can capitalize on a big opportunity. And that opportunity is turning a contact center and the reps in that center into true agents of change for better patient engagement and satisfaction. With that, I'm going to turn this over to Joe, who's going to tell you about how Spectrum Health views patient satisfaction in the digital ecosystem. And Joe, the floor is all yours.
Thank you very much, Mark. My name is Joe Brennan, Senior Director of MedNow, which is Spectrum Health's telehealth program. A little about Spectrum Health, if I can just get there we go. We are an integrated health system. We are a hospital group with 12 hospitals. We are a medical group with 1,600 providers, and we are the second largest payer in the state of Michigan with Priority Health, having now about 800,000 covered lives. So being part of an integrated system has really allowed us to focus on understanding who the member and patient is and how do we reach them in a way that fits their lifestyle today. And so we've, as a strategic advantage, created a digital ecosystem of sorts. So just like Google has a series of apps and products that fit within their ecosystem, Spectrum Health has the same. So obviously we have our website for both Spectrum Health and Priority Health, but we've added the Find a Doctor tool that Mark mentioned, that people are shopping, they're looking for who their providers are. And so we customized a website that would allow patients who are in need of a specialist or primary care provider. Our cost estimator tool with Priority Health was one of the first in the country, and it provides members the opportunity to anticipate what they would be charged for certain procedures. And that what you see in the bottom right-hand corner, My Health, that is our patient portal. That's how this whole conversation began. It was our customized My chart that gave the features of what people were looking for. But we were able to take that portal and expand even further. And the part I'm going to talk about in detail is that MedNow app. So myself and the MedNow team are responsible for driving MedNow, which is our telehealth program. We break our work into two groups. We have what we call direct-to-consumer. So that is low acuity primary care connecting patient and provider on the patient's own device. It's available 24 hours a day, 7 days a week. It's at a $45 price point, so if insurance is not covered, it's something that is a little more palatable for people to pay, and it's also something that gives access within minutes as opposed to waiting hours and days to get into an office. And our other book of business is what we call specialty care, but that is more of the traditional telemedicine of clinical space to clinical space. So we bring our Spectrum Health Medical Group specialists out to the 8 regional hospitals that we have within our system, and we also partner with other health systems that don't have that specialist available to them. The value proposition for our specialty care is really eliminate the barrier of distance for our patients so that they don't need to always travel down to see that specialist. But I'm going to focus right now on our app, because again, what Mark was talking about and what Matt will get into is that our behavior is different. We now, more than 77% of the US population has a smart device in their pocket. We now hold the technology in order to connect to our provider, but it's also how we engage in many different aspects of health. And so we took data from the experiences that we were learning from a pilot phase and really developed an app that is different than what's out there as it relates to telehealth. Two things that I would focus on: the data told us that the patient doesn't necessarily expect on demand. You'll hear that telehealth for low acuity primary care needs to be something that is on demand. And what the data told us was that people preferred to schedule it. It's something that they wanted 1 to 3 hours out, as opposed to when they initiate the app. And so we were able to adjust and provide it something that would be scheduled as opposed to on demand. And we learned that from the data. The other point that we learned was that a medical assistant is critical to the experience. And the reason being is, not only are they there to put the information, because the patients were telling us that filling in fields of medical history was something that was arduous and cumbersome, and it wasn't something that they wanted to do. And so to make it feel very much like an in-office visit, we have a medical assistant who will actually help put that information into the electronic medical record, and also offer low-touch tech support. So if this is the first time someone has used our app and they don't know that they're muted, or they're having trouble pulling up the video, we have that human being to be able to help them out. And so those 2 points alone are really decisions that we made in the patient experience based on not only anecdotal feedback from our patients, but also the data was telling us that. And I think Mark hit the nail on the head when he said that there needs to be an overarching connective tissue, and for us, that is our electronic medical record. The ability to carry that patient's information and pull that data that lives within that electronic medical record and utilize it in ways that we haven't done before. And so since we started this journey about 4 years ago, we based our data collection on some simple things. How many people are we seeing, and what results were we getting from there? So to start, this is the information that we were seeing. So we've seen almost 50,000 patients in the last 4 years, but we would also track transfers, because we wanted to see if patients and their families were being able to stay local within their communities and not be transferred down to where the specialists were within Grand Rapids. And in our direct-to-consumer model, are we avoiding urgent care and emergency visits? That may not sound appealing to those in finance who are on the call today, but if we are going to truly transition from a volume-based healthcare system to a value-based healthcare system, we're going to need to find a more cost-effective way to deliver care and keep people out of the emergency department. Another huge factor that we measured from the beginning is this availability and this access to care and this digital tool, is this something that is going to encourage people who don't have a relationship with our system to give us a try? And what we found is nearly 1/3 of everyone who uses our direct-to-consumer product are new to the system. So as Mark alluded to, if you're not thinking digitally and you're treating patients the way you always have, you're going to miss significant opportunity. Those that have adapted and are looking at a digital approach that engages the patient, those are the ones that are going to not only capture, but also retain those patients. This is lowering the cost of care. So we are able to quantify how much we are saving by offering telehealth. And then my favorite, which actually you can't deposit into a bank account, but we track how many miles we save patients. And we're approaching 1 million patient miles saved. But when you think of what digital brings and what virtual brings, it allows the patient to remain where they are as opposed to going to a bricks and mortar location. So in order to take all of this data and digest it properly and use it the way that we wanted to use it, we had to create a very robust dashboard. And so we took that information from the electronic medical record and we filtered it through Tableau. And we were able to create a 14-tab dashboard that really gives us the information that we need. And so what you're seeing right now, this is our homepage. Obviously we have encounters, but we also wanted to know what is the likelihood to recommend that our patients are having? How many patients are new to the system? How many miles are we saving them? What are the savings to other payers? What payers are people using? And then ultimately, who is the demographic that's utilizing our service? When we initially built this program, we thought that this was a product for millennials. This was something that younger generations were going to use, and probably primarily males. We found out we were very wrong. Our average user is a 35-year-old female, significantly more female than male, and that age of sitting around between 32 and 40 is really who's utilizing this service. And the idea of the alpha daughter, the woman who makes decisions not only for her family, but also has siblings who go to her to ask healthcare questions, and lives in a sandwich generation that helps make medical decisions for their parents. That is the demographic who sees the value in the access and convenience of virtual care, and those are also the people who tell our story very well. We also need to track those clinical data points, because telehealth being new, digital engagement being new, there's a lot of skepticism. And we are in an industry that still utilizes fax machines and pagers. This is yes, we're in the middle of a disruption, but it's still antiquated in certain areas. So we thought it important to track the clinical aspects of it as well. And so an example of this is what you're seeing now. Telehealth is viewed as a pill mill. I see someone, which is HIPAA compliant FaceTime, and in 2 minutes they'll give me an antibiotic. And so we knew right from the beginning that we need to measure prescription rates so that we could tell the story accurately. And what we found is that our virtual health program prescribes less average than not only the national, but what our in-person primary care offices are doing in the 27 locations within Spectrum Health. And so to have the data and to have that information to be able to articulate that to skeptical providers, to skeptical patients, really being able to tell the story well. And then obviously understanding who's utilizing our service for what conditions at what times, because piecing this all together is really going to give us the opportunity to reach out to the people we want to reach out to. The other benefit of being digital and being mobile is that we can see people's behaviors. And so Google Analytics, which our app ties into, we can better understand what screens are people staying on, what screens are people not using, are there opportunities where we can improve a certain aspect of the experience, what devices are they coming from, are we seeing an upswing in tablets versus smartphones, what models work well and what models don't. So there's a lot of information that comes just from the app experience. But at the end of the day, everything that we see in that dashboard and everything that we see in this dashboard, it really helps us create a patient experience that is something that they want to continue to use. And so we take the data from Epic, we'll take the data from Google, we'll take the data from Facebook, and everywhere we've been able to pool that data so that we can reach more people, because those that are in their digital journey and those that specifically are in their telehealth journey, awareness is the last great barrier. The technology is now omnipresent. Everyone has it in their pocket. Reimbursement barriers for many states are starting to fall. And provider buy-in is something that used to be a struggle, but now they see that this is a viable way to treat patients. And so that final barrier of getting in front of people and letting them know that this is a way they can receive care is something that we were focused on. So when we began, we would send a mailer out, which we didn't see much response from. And then we put billboards up. And we laugh now that we would try and show people what virtual health was by two people staring at an iPad on a billboard that someone drives by for 3 seconds. Obviously, that does not have the impact that we had hoped for. But understanding that demographic of the 35-year-old female, well, let's try social media. And so a campaign that we launched with Facebook was incredibly successful. We were seeing rates on activity through social media and targeted emails that were significantly higher than other industries. And so it dawned on us that if we utilize all this data to understand who our target market is and who we're looking to reach, how are we going to reach them? And then we can take the data from that and understand what's effective and what's not. And so it's actually cyclical. We use the data from the people who are using it to reach more people, and then when more people use it, we use that data as it spreads to figure out what clinical changes and experience changes we need to make. But if you look at this, and it's a bit of an eye chart, but we've had significant success considering that we started small with targeted emails and paid searches and social media. And it's really grown to be one of the most effective ways to communicate how our digital ecosystem works for our patients. And at the end of the day, when you think about why would a health system put resources and take new approaches to marketing and build a very robust dashboard to understand who's utilizing and when they're utilizing it and how, it is that transition that this industry will eventually take from a volume-based fee-for-service world and transition to value. Because when we live within a value-based world, you need to have the competencies of virtual care, of low-cost care delivery. And so we continue to utilize all the tools that we have, but improve and add things that our patients are wanting. And what you see here as it relates to cost savings, we have that medical assistant ask every patient, if this service were not available, where would you have sought care? And because we are the second largest payer in the state of Michigan, we can take claims data to understand how much those alternative care settings cost. And so we're able to average, based on the response of the people who are utilizing our service, what would be the cost savings. And our direct-to-consumer offering through the MedNow app, every time someone has a visit, it saves $123.17. And so we set out to initially open up access to primary care and to specialty services, and at the same time lower the cost of care. But the only way for us to be successful, if we were to do it in a way that is satisfying for both patient and provider. And so with about 50,000 encounters under our belt, I think we're making progress there. But we're very happy with where we stand today, but we know we have much further to go. And so I appreciate everyone's time today. And with that, I will pass it off to Matt.
Okay, thank you, Joe. And prior to that, thank you to Mark. I'm batting a little cleanup here. Just for a few minutes, wanted to maybe tie together a few things that have already been talked about, both contact center related, as kind of Mark spoke about, and customer interaction, as well as a lot of the digital pieces that Joe touched on. So I lead our healthcare solutions division here at Neustar. If you don't know Neustar, we're actually really the premier identity management provider here in the U.S. and have been doing more and more work, particularly within healthcare. We work with about 3 of the top 5 payers and an increasing number of providers and hospital systems, et cetera. What I'm just going to talk about in about 5 or 6 minutes is augmenting the discussion that's already gone on about data being so critical, with a little more direct customer experience feel, let's say, and to help you better understand when you're interacting with patients and members, how can you do that in a better way, and how can identity play a role in that? The premise is that if you don't know immediately with authority who you're interacting with, everything sort of breaks down or can go south from there. So how can you leverage data to improve operations and build better customer experience? It's really all about identity. What you can see from the data here is that this problem is hard to solve for. So this is really third-party data, not my company's data. But you can see every year 75 million people are changing their phone carriers, 45 million changing phone numbers, 60 million relocating. So what we've seen is 60% of data is wrong in a 2-year period. And that's really significant. So think about the interactions that you're having with patients, members, customers, and the problems that incorrect identity data or identifiable data creates. So calls into the contact center, as Mark talked about, adds minutes onto which is very costly, minutes onto the conversation. Online interactions where maybe you're doing knowledge-based authentication or two-factor authentication can frustrate customers and cause customers to drop out. Visits into the hospital or pharmacy or lab with improper identification can create fraud. And adherence in healthcare is a growing trend. And if you don't know who to call and when to call and who's on that other end, it can decrease customer satisfaction as well as cost a ton of money. So that has these downstream effects of all of these problems you're seeing on the slide here. It depends where you are in the ecosystem. So how do you solve it? A big issue is that there's no single source of member identity data, and compounding the problem, creating these lower engagement rates and bad experiences and increased risk, is that there's been a lot of consolidation in the industry, and it's a very complex ecosystem. So what can we, or what could you potentially do about it? And we like to use the term connection science, where we take we create these linkages, and I think Mark may have mentioned that before. We create linkages in data to enable better interaction. So it's taking member or patient identifiers externally that can be provided, as well as what you have internally, marrying that to what's in, as an example, your CRM, and then using this science to authoritatively be able to say, who, or to know who is on the other end of this interaction. And what this enables is it enables you to take a singular view of your member or your customer across your organization. And once you create this singular view, let's say with a unique identifier, or we would use the term an E-key, and you create a complete and accurate identity of your consumers, you enable all these benefits on the right, which are truly understanding your omni-channel members and reducing costs and waste and delivering more relevant connections. And just diving a little bit deeper into that, these linkages are sort of represented on this slide. And you have what we call offline identities, which are things like name, address, phone number, which I mentioned earlier, are changing constantly at a surprising rate. And then we link those to digital identities as well. So that's kind of bridging between the previous two speakers, right? IP addresses, using cookies, device IDs. And that science is knowing which of these fractional identifiers really go together for the person you're interacting with, and it's real time and immediate. And you've got to get those linkages right to be able to then enable these trusted interactions wherever you are in the ecosystem. So here's just one small example of using this. So let's say an example where you're looking at your CRM and you have this data on John Smith or Smythe. I think it's Smith in this instance, but maybe a misspelled name. So how can you use some of these linkages to create better interactions? We would use the term sort of a cleanse and append here, where you get you make sure you have the name spelled correctly for your patient or member or consumer, and you verify that you have the right address. But it turns out that maybe John has changed a phone number, and there's a better phone number for John and a better email. So, and all of that's going to create better walk-in, inbound, and outbound communications. And the other key is that you're continuously corroborating this information because it does change. And what we found are sort of these 5 pillars are what's critical, or critical to quality for building the right kind of identity management within your organization, wherever you are in the ecosystem. And I've touched on each of these very, very briefly. It's consolidating to a singular view, completing it for whatever fields of information you're already collecting, enriching it perhaps with other information you don't have about that member or customer, and augmenting it, and then being persistent about it and constantly monitoring and unifying it across your organization. And that's what creates tremendous benefits really across the entire life cycle. I'm not going into the detail today really across the life cycle, but you can kind of see what's represented here in the upper left in a patient or customer care scenario, the benefits of getting identity right. And there's risk and fraud applications from TCPA mitigation and other fraud use cases, revenue cycle management in the bottom right, and many marketing applications for cross-sell and upsell, or blending marketing and care, open enrollment and or Medicare enrollment type applications. So this really just kind of scratches the surface. There's plenty of use cases across inbound, outbound, really throughout healthcare. I just want to give you a flavor for how identity is the foundation of enabling so much more efficiency in communication. So that's all I was going to go over today. I'll actually throw it back to Mark to facilitate some Q&A.
Thanks, Matt. And we have some questions here from the studio audience. So, well, let's do this round robin. Why don't we all kind of chip in here with kind of Joe and Matt driving the process. So this one is for Joe, but let's hear what Matt thinks too. So, for instance, what kind of personnel do you need on staff to help implement some of the things we've been talking about here for the past 45 minutes?
Well, we originally had created our team. We didn't have anyone dedicated to data. We would rely on our informatics department, which worked well, but it wasn't the speed that we needed. So hiring someone specific to data was critical to our success. Also, because we are taking new channels as it relates to marketing and consumer engagement, having that in-house on the team is really one of the contributors to our success. So having those competencies as part of the team, as opposed to utilizing other departments where you had mentioned where, you know, those silos where the information lives, bringing it in-house has really allowed us to be more nimble and more reactive to what patients are wanting.
Yeah, and I'll just chime in. This is Matt. Yeah, you know, from our perspective, working with companies all around healthcare and other industries, I don't think we've seen where there's an addition of some new skill or new role to absorb and take advantage of getting identity right kind of in the organization. Now it's augmenting, right, what you already have and making it more correct. I have seen initiatives. I've seen more and more, particularly in healthcare on the payer side, where they're creating this, hey, we want to create this one view of the customer across our very complex enterprise. And I've seen project teams be created, but it's really, you know, focused on that effort and creating that vision. And then we're sort of helping that to be realized, but it's not necessarily hey, we don't have some expertise to be able to use this today or figure out how to use it. It's really an organizational commitment in leveraging the existing resources you have, and now you're just getting more data, more insight that you didn't have before.
So next question here has to do with kind of use case. In my presentation, I kind of mentioned that, you know, if you've got a single source of data, if you've got a better way to identify who is contacting you by text, email, phone, what have you, you've got a lot more ways to open things up for how you can engage who is making that contact. So I referred to this New York Health system that is going beyond just doing the, you know, the basic customer service, if you will. They're trying to get into how they can use their contact center or their digital platform to reach out and do better outcomes through more patient outreach for, you know, chronic disease like diabetes. So having prefaced all that, and let's ask Matt this first, what type of healthcare use cases does identity data solve, do you think?
Yeah, okay, sure, happy to take that. There are a few of which I've mentioned. Maybe the best way or the way I tend to think about it are, let's go to the contact center, and people tend to think about outbound interactions and inbound interactions. You know, from the outbound side, we see a lot of kind of use cases. I mentioned patient adherence programs. We're seeing that a lot where healthcare companies are more incented than ever before to ensure patients are, you know, following a prescribed process, if you will, or staying on certain medications or picking up medications, all of those things. So that patient adherence outbound perspective, you have to have the right number, know who to call, the best time to call, has anything changed, and am I compliant with TCPA? There's a lot of collections in hospital systems, and from the, provider standpoint, where you have outbound, you need to know, again, do I have the right contact information for collections? We see a lot also in after open enrollment or other sort of enrollment processes in healthcare, where you need to do an outreach to a customer to you want to further verify or complete information in a process. And I mentioned TCPA compliance is big. We do that for a number of healthcare providers for helping ensure they're compliant. On the inbound side, and Mark, you did talk about this, where what we'll do is we found that most healthcare companies might identify somewhere between, I'm going to say 55 to 75% of their patients or members who are calling into their contact center. And we help augment that, where we can immediately identify, hey, this is Matt Edmonds calling, because we know that mobile device that wasn't in your CRM, that number, we can recognize that mobile number ties to the identity of Matt Edmonds. And so now that's a very simple way to describe. Now, all of a sudden, instead of you identifying 65% of your callers calling in, you're identifying 80+% of your callers. And so there's just, and providing then your agents in the call center information about Matt Edmonds. So you're not having to take all of that time and clunkiness, if you will, or friction in the process to verify information. So that helps on the inbound side. Just the other ones really quick that we do besides what I described. I touched on knowledge-based authentication, which we're seeing more and more people move away from, because knowledge-based, you have a lot of people that drop out of the process if they have to go through questions to verify their identity. And then it's this vicious cycle of, well, then we should make the questions easier. Well, then if you make the questions easier, then you kind of open yourself up to more fraud. And then that doesn't kind of answer the question. So using that offline and digital identities to more authoritatively identify who's on the other end of that digital transaction, is another sort of use case. And then the last thing is we do a lot on the marketing side of the house, leveraging a cookie network, for example, we call it multi-touch attribution, if anybody's familiar with that term, where we can help companies identify what marketing avenues they're using, what's most effective, right? Like, so what did Matt Edmonds sort of react to or respond to from a marketing perspective? Was he on the website or some other advertisement that drove him to call in or respond to something? So there's a lot of that you can do with particularly digital identities to help give healthcare companies insight. So I know that was a ton, and that was probably, a third of them, but I'll stop there.
So Joe, to kind of maybe frame the question just a tad differently for you, you laid out in your presentation, Spectrum's ecosystem for all things digital. Then you talked about the analysis you did tied into the patient record to kind of view the results that you presented during the presentation today. So if we take this question of holistic plan member patient data, what does that enable you at Spectrum to do that you couldn't do before? What does this make you do better is the question, I suppose.
Well, I think it's better understanding what the patient's needs are. To Matt's point, if you think about where this was 3 or 4 years ago, it was a solution in search of a problem. But I think it's now where we can use these tools and this capability and apply it to improve the patient experience. Because at the end of the day, as healthcare evolves, you're going to have an experience that someone wants to continually keep that relationship with. So now that we have data from all these different sources, it helps us better understand what our patients' needs are, what they're looking for, and how we can adapt and meet their needs.
So this next I'm going to call the how come these guys get a question. So, we spent 25 minutes hearing from a health system in Western Michigan, a very large one that has a game plan and results for doing holistic data, patient management, a digital healthcare program that improves their competitive position in their marketplace, if you will, in this case, Western Michigan. I talked about this very large New York health system in arguably the country's second or first largest healthcare market, and what they did to get better results and outcomes for, in this case, using their contact center for patient satisfaction. So my question to both of you, and let's start with Joe on this, is Spectrum, Langhorne, yeah, you guys get it, but how come other aspects of our diverse healthcare system do not yet get it? What's driving that disconnect, do you think? Joe, why don't you answer first?
Well, I think the biggest lesson that we've learned in our 4-year journey as it relates to telehealth, but also more broad in digital, is that change is really hard, and change is harder in healthcare. I had a physician tell me once that we don't like different because different leads opportunity for risk, and risk means someone gets harmed. And so you have a risk adverse industry because we have done what we do for a very long time. So I think what the lesson that we learned, and I think that applies to your question, is that this isn't about technology. This is about change and really being engaged in helping define what future healthcare looks like. And so other aspects of the industry are just hesitant to make that change.
And Matt, what's your take? Yeah, I think it's similar to that. I think that's a really good take by Joe, and it's the change, resistance to change. You know, we do see, particularly in the, let's say, as it relates to the contact center, which I've been in and around that business for 20 years, and I've seen a lot in healthcare. Oftentimes it follows financial services as well, which tends to be, there's just more transactions in the call center, so they tend to be concerned about things first. So I'm seeing now healthcare, you know, a couple years sort of following the same footsteps of dealing with issues as it relates to data and identity that financial services was doing a few years ago. And things like identity, where we play, it's taken for granted because, you know, let's say 50 or 60% of the time, it's not a concern. You know who you're talking to, and it's right, and there's no, you know, HIPAA, TCPA violation. But an increasingly percentage of time, and now more and more mobile customers, it's becoming a bigger problem, or that 30 to 40% of the time, people are now realizing, wow, this is putting a big drain on customer experience. I think that's the other piece, is this pivot to viewing people as customers that you kind of touched on, and the customer experience, all of this data to remove friction and things like that are moving to the forefront. So it's still moving. I think it's moving quicker now than 2 years ago for sure. And I think we'll continue to see the pace of change here over the next year.
And this will be our final question. So why don't we start with Matt on this one too? All of us in these three presentations over the last 55 minutes, we've talked about, you know, the isolation silos, the need for better universal data access, holistic patient data leading to better satisfaction, better outcomes, that type of thing. So the question for Matt and then for Joe is there anything that can be done to reconcile various member records to understand what the latest and most accurate member data actually is?
Well, that's probably a little bit of a layup for me, if I understand the question correctly. I think it's just kind of going back to the gist of what I tried to touch on, which is there is absolutely, you know, a huge repository that we have, and many other companies are these data aggregators of intelligence on consumers out there, right? But what you can do is you can take whatever information you have today, and it's actually not too difficult to do an analysis to say, okay, then if I leverage one of these vendors, so let's say i.e. Neustar, with all of their quality of data or quantity of data, how can they then augment what I already have? Going through that example on one of my slides, right? So, you know, some customers I work with are more interested in, I need to have the phone number correct. Others are, I need to have correct emails for these purposes. And others are looking at it holistically across every possible offline identifier that they have. So that's really kind of what we're doing a lot of, is just leveraging our database and then looking for really just linkages to, that'll be the last point I'll mention, to the linkages of that data. It's not just about a dump where we would just give you a ton of information on Matt Edmonds and sort through this and figure out what's right. I think where we apply that science is we only want to give back to you because we think you only probably want, with a high degree of confidence, this information ties to Matt Edmonds' identity because we've corroborated it across multiple different sources. So, that's the way we do it and focus particularly on the quality of the match.
Joe, what's your take? I mean, is the electronic health record the holy grail for all this?
I think so, but the buzzword 2 years ago was interoperability, and people like to use it, but you didn't see much movement. I think now it's a must. We must have whatever we're working with talk in a way that we can all work together. And if you don't have interoperability and things live in different compartments, then you do have 12 records with one system. I think the other thing that we're trying to get to with an ecosystem, a digital wrap for the patient, is that if you give them one or two front doors, they build a relationship with you. So your information is going to be accurate because they go to you not just when they're sick, not just episodic, but they go to you when they're for wellness or questions, or make your health system the go-to for all things health. And if that's a digital app that includes this suite of services, I think that's going to help you really understand who your patient is, make sure that it's accurate, but also meet the needs.
I'd like to thank Joe and Matt for their presentation today. I'm sure everyone learned a lot and got some key takeaways they can consider incorporating into their own strategies for better patient satisfaction. Please check out the white paper on this topic we collaborated on, detailing many of the key concepts we talked about today. The link is right there on the screen, and you'll be given access to the desk in the next 24 hours, to the deck, I should say. I also want to mention to attendees that after we conclude, you'll see a pop-up window on your screen asking you to rate and provide feedback on today's webinar. If you can, please take a few minutes to respond. Your feedback very much helps us plan future webinar topics and understand what kind of presentations work best. Finally, please keep an eye out for our weekly email to find out what other webinars we have planned, or visit internetretailer.com webinars to see our upcoming schedule or view our library of archived webinars. Thanks again, and have a great rest of your day.